Gotta share.
Paxi, do you want to come?
Do you want to go on the sofa?
Yeah, come here. Come. Lexi.
I don't.
Oh, my goodness.
I
Oh, my
hate
goodness.
this.
Hi, everyone.
Oh, buddy.
This is a little surprise.
It was a delightful surprise.
So happy. We're in Whistler, BC, and as you may know, I am in North Vancouver, and Dr. Ruth Roberts, my dear friend, is here today. And we decided we were just going to chat. It's not going to be one or the other person doing an interview. We just wanted to chat and just kind of wanted to share some of the, I don't know, ideas and maybe slight opinions. Opinions are not truth, so it's
That's
okay.
true. Opinions are opinions. And kind of experiences.
And Hiyo here,
Hiyo.
a 14-year-old lovely traveler. Dr. Ruth and I have had very similar path, right? Like we've been kind of doing similar things. We practice and then we decided we wanted to share some of the acquired knowledge that dogs taught us with you. So we go between Europe and North America and try to learn more from dogs and try to pass that on to you, translate it into human, from canine to human.
Yes, and things that you can actually use and take action on. So it's not so confusing because that's
Exactly.
part of it. Like there's so much information.
It is confusing.
Yes.
And it's kind of complicated, I think, that we sometimes make things more complicated than we need to have them, I think. What do you think? Like,
I agree.
What is the level of complexity that we need? And what is the level of complexity that we witness out there?
Yes.
Like, what is...
And that's the frustrating thing, right? Because so many pet parents are confused. And so they listen to somebody, they go buy some supplements, they listen to somebody else, they go buy those supplements. And then by the time they're talking to you, to me, to the coaches, the dog's on 27 supplements. And
everyone is confused.
yes. And
the body is confused.
The body
actually.
is quite
Yeah,
confused. And that's the difficulty, is that how can we make this simpler and help you figure out how to break it down into whatever the problem is you're facing, the challenge, into the simplest method possible to start making an impact.
And you know what I sometimes hear, that people do not know who to listen, and medicine is almost like music. Everyone has slightly different style.
Indeed.
And they all may work really well. So just choose the person that just kind of jives with your ideas and thoughts that feels good. And it can be a few, but I definitely feel that people run from one thing to another. And I guess sometimes the person who is the loudest may actually convince the most people. May not be always the most effective way.
No.
Yeah.
And ultimately, if we're trying to go back to simplicity, the difficulty is that we want to take the pill to make the thing better instead of understanding why the thing is there.
And the whole body, because I think
Yes.
that people often look for this for that approach.
Yes.
Instead of just kind of looking at the body and see, okay, what does the body need? Does it miss any nutrients, or is the
Yes.
diet wrong, or does it need to detox, or is the spine out of alignment, are the hormones out of whack?
Right on.
Out of whack, that's very professional. I'm very medical today.
It's better than hinky.
Out of whack. Out of whackitis.
Yes. Yeah.
It's a bad disease.
It's better than some of them, though. But I think you're right. So we're trying to move from Western medicine's concept of, if you've got this, if you've got a headache, you take an aspirin. If you've got back pain, you take a high-powered aspirin, a high-powered non-steroidal, instead of understanding why is the back pain.
Yeah.
And I think that's transferred into natural medicine as well, where, okay, my dog has horrible bowel disease, and so I'm going to go buy this bowel fixer kit.
Yeah.
And sometimes that's a good approach, but sometimes it's not so much.
It can be a good start to actually balance the digestive tract, but you know,
Yes.
some dogs may have diarrhea because their lumbar spine is out of alignment, and people
Yes.
really don't go that far. Maybe they're stressed. Maybe their loved ones are stressed, and they're expressing it that way. Like, has anyone had runs before exams? Like, no,
No stress here.
Zero stress. Med school was absolutely zero stress. Nobody was mean.
No. Nobody developed IBS during the course of veterinary school. No.
How do you like our little supervisors here? Like, Pax was actually a little cuckoo this morning. We went to the lake.
Yes. And he was having a grand time.
Kind of, like he's trying to rescue me lately. His little new repertoire is that he tries to rescue me when I go swimming and barks a lot. And then people get upset.
And then you get lectured.
Oh, I got lectured. You know, one of the reasons why I love being in Europe is that people don't lecture you on what you should do and you shouldn't do. And I love Canadians, but they love to lecture. So some, not all, you guys. I know that you're not like that. But so we went to the lake and, you know, I went swimming and Pax was trying to herd me back to the shore because he thought I wasn't swimming really well. So he wanted to save me or rescue me. And when I got to the shore, I actually apologized to the person who was kind of like really nearby. And instead of kind of like coming to some sort of understanding, dogs are dogs and that I won't be there forever, he started lecturing me. So
it's a frustrating problem. And so we live now in Slovenia, but Montenegro part of the year. And that's part of the charm is that unless you're really harming someone, it's live and let live. But it's frustrating because we have that social media mentality where somebody makes a post that offends you. And so many people feel compelled to just go to the mat on that person.
Yes.
Instead of saying, okay, this is not for me. And that feels like it's spilling over into day-to-day life.
Maybe a little bit. Like I just feel, and you know what my comment usually is, like when you follow all the rules, and there was actually no dog sign. It was like all dogs were allowed. But I think that people just cover up their own sins in quotation mark to actually lecture other people, you know?
Yeah.
That's the shadow effect. I'm not sure whether you've seen the movie Shadow Effect.
No, I haven't.
Oh my goodness. Like this is one of my favorite movies because it actually explains. It's called The Shadow Effect. It's on YouTube. And it explains that people who, let's say, are very adamant about certain topic, let's say a politician against prostitution and so on, like finally you would actually find them running a prostitution ring or something like that.
Or frequenting one.
Yeah, so the shadow effect. Or if we don't like angry people, we discover,
we are angry.
Yeah, because we are angry and so on. So it's actually a really, really interesting reflection. It's really helpful to actually understand people in that way.
That makes sense. And then here's these guys that are trying to show us the shadows we're trying to avoid.
Yeah, the lack of perfection. Like, you know, as a Czech, I'm a perfectionist. Like Czechs are horrible on that level. And Pax is pretty good. Like he's close to perfect, but he's not perfect. And when I see him misbehave or something, I get kind of internally upset. And then I realize that I'm just too much.
you're putting the old habits back in.
Yes.
Yeah. So and Hiyo had to stay here because she is unable to walk for long distances without increasing her discomfort. So now she's having her little crazy happy times, which is so much fun.
Yeah, we had to leave her behind. Oh,
yeah, she was so mad.
Pax wants Hiyo to be coming. If Hiyo is missing, you know where she went.
Where is she? Where is she? Yeah, he's very genial for sure.
Yeah.
But I think one of the things we both experienced, certainly you've spoken often and loudly about Pax's experience with hormone replacement therapy. And what I've been sort of quietly doing in the background is the same for Hiyo. So the idea is that females should only have estrogen, I think, is erroneous on the human side, especially once you get past a certain age. Estrogen is no longer recommended. And so testosterone and progesterone would be the go-to replacements. So for Hiyo, she's been receiving testosterone cypionate as well since March. And over the 4 months, so for reference, Hiyo's 14. She has a lot of cervical and thoracic arthritis secondary to having broken her leg and walked weird all of her life. And what we've seen, he's like, I'm done.
He wants to guard something. He saw a squirrel or something.
Yeah, something.
It was kind of warm on my legs.
But what we've seen is she's actually gained weight.
Okay.
Which is amazing for 15-year-old dogs. She's gained weight and muscle. Yeah. And that's not what we were expecting. And obviously, she's much more playful. She's feeling better.
Wagging her tail,
happy. So it's really made a huge difference in her quality of life.
You know, I can see the potential, and I also like and really appreciate that we all have been kind of diving into hormone replacement therapy from a little different perspective and just kind of trying different methods and see what works.
Yes.
And so we'll need a lot of research still and just kind of compare notes. And the good news is that the metabolic rate and quality of dogs that are put on hormones when they're missing just changes, and it changes their chemistry of the body and the metabolism and the brain as well. Like that's what I noticed with Pax. He's just a completely different and much happier dog. And for those of you who don't know, Pax was neutered at the age of 2, And then he started limping, and for 2.5 years, we couldn't solve it, even though I thought I knew everything. It humbled me terribly. And then we put him on the hormones, and the protocol that I've been using has been working as well, amazingly. So, and I think that female dogs, we still need to actually finely tune the protocols and see what works and what doesn't, but
Right.
it actually makes sense because females in real life also produce testosterone.
Right.
So, yeah.
And to be fair, she's 14, so she's past. So and
Reproductive
right,
age, yes.
right, and
Yes.
so that's where estrogen can become a potential health problem in terms of elevating risk of cancer, stroke, etc. for women. But if she were 6 and she had urinary incontinence, for instance, and the veterinarian said maybe you can try estrogen, would be perfect. So this is where we are, and this is it. We're just trying to figure these things out. And thankfully, we have some really strong allies that are helping us do the science.
And Dr. Ruth has done a lot of work in writing on that topic, and I also have an article on my website on that. You probably have an article on your website
Yes,
on the topic.
several videos on YouTube. Yeah.
I think that what is really important to also emphasize that the research that was done many decades ago, suggesting that there's an increase of cancer with estrogen supplementation, the increase was actually relatively small. But what they did, they used relative numbers, right, instead of absolute
The nurses
numbers.
study
Yeah.
you're speaking of, yeah.
If there's an increase, let's say, of 50% from, let's say, I'm going to just give a number, not exact example, 0.05 to 0.075, like it's just not, it's not a big increase.
Yes.
But, it's 50% increase. So,
Right.
When I compare the quality of life that we can achieve with dogs on HRT, it's unbelievable.
Yes.
I've seen it over and over with young dogs and older dogs.
Yes.
I know a friend and colleague, Dr. Becker, who actually has been using hormone replacement therapy in 17-year-old dogs. So it's kind of amazing how it works.
It really
And
is.
we work in a community.
Yes, agreed.
So we'll be bringing you more information with all the scientists and researchers who
Yes.
are participating, Dr. Kutzler and Dr. Linda Brandt and other people.
Yes, and I think there's more and more interest now about helping our colleagues understand that spaying and neutering isn't, and this is the difficulty, right? It's a double-edged sword. Because when we both started in practice, pet overpopulation was an enormous problem. It's still a problem, but
That's still a problem.
spaying and neutering helped bring it in, but it's a double-edged sword. And so there's a way to keep these guys from reproducing, but also keep them healthy. And that's what we're on the mission to figure out, is how this is most sustainable.
Exactly. And I have some people and even former clients who I know for a long time getting upset with us because they're saying that we are promoting homelessness, which is not necessarily true. The shelters can actually do ovary-sparring space
Yes.
and vasectomies.
Yes.
So when you do that, as far as I know, dogs can get pregnant with vasectomized male.
No.
And a dog without uterus, right?
Not going to happen. Yes.
Yeah.
That's it. And there's other options too. I think, in the EU, there's supralorin, and that's available off-label in the United States for ferrets. So it's labeled for ferrets, I should say, but there are some veterinarians that will consider using it off-label. And the way that works is to prevent the production of gonadotropin-releasing hormone, so the rest of the sex
And
hormones
luteinizing
cannot.
hormone.
Yeah.
Supralorin actually is used in some of the protocols to suppress the luteinizing hormone that causes inflammation in the body. So that's why you may see dogs suffering from chronic condition and inflammatory conditions from knees and thyroid gland and organ disease and cancer, skin issues, ear problems,
Cognitive issues,
cognitive
IBS.
issues, actually changes in behavior,
Yes.
aggression and fearfulness that is
Yes.
unexplained. So
Yes.
now we know that if we suppress the luteinizing hormone, that in spayed and neutered animals it doesn't have anywhere to go.
Yes.
If we suppress it, the animals actually calm down and the
Yes.
inflammation goes down. But then we have to supplement the hormones. And Dr. Ruth is using a protocol that is without the supralorin, which I really appreciate because in the United States, it's difficult to get supralorin and
Yes.
get veterinarians to actually
Yes.
administer that. So
Yes.
we'll have to be comparing our notes, and I'm so excited.
It's very, very exciting to make the next leap into health for these guys.
The most fun part is, I'm not sure whether you guys know, but I have not been really going to conferences and just kind of socializing in the community in real life. And I went to Orlando to a conference and I met a few lovely colleagues and it was amazing. And now Dr. Ruth calls me or texts me and says, I'm in Whistler. And I go, I'm an hour and a half away. So we made a trip. And we didn't actually plan to record, but I have to disclose something if you're
Sure.
okay with it. I actually have had really serious issues with connecting microphones to the phone or to camera. And yesterday I bought a microphone and I didn't know that I bought it for this really fantastic chat. So we should take advantage of it.
Yes.
A little more.
Yes.
Is there anything else that you want to tell me?
So why don't we talk a little bit about, so we started at the beginning, that there is not one path. There is not one single approach that will be right for any animal, every animal, I should say. So what are your thoughts on that, and how have you experienced that through your practice life?
Oh my goodness. So I'm a simple guy when it comes to medicine, meaning that I look at the patterns and see and observe. And so I get inspired by nature that actually does healing fairly well. Like it basically gets rid of toxins and cleanses on the beaches and through creeks and rivers and water and rain and so on. And then it provides nutrients, and then it resets everything and, sheds the leaves. And that's how it goes as well in nature. So when you look at dogs, I'm going to say dogs or humans, we really need to look after the basics, and that's detox, and that's providing the right food and the right nutrients, because soil has been gradually depleting more and more. Even in 1992 records, and the research said that soil was about 85% depleted of minerals.
Yes.
In 1992. So what is it now? Like, is it 90, 95%? I don't know. So the people who actually say that dogs and people don't need any supplements, I really would like to challenge them and say, hey, let's go for a run. Let's go for a bike ride. Let's go for a swim and see how we're doing, right? We're proudly in our 60s.
Right on, my friend.
I think it does make a difference. And then aligning the spine, making sure that the spine, the energy highway of the body is actually aligned and without injuries. And that's really good. And Dr. Laurie McCauley is teaching people how to prevent injuries. She teaches people how to use laser as well and all this. I'm getting all excited about this. Yeah. And then hormonal health, obviously.
Yes.
And then there are some metabolic boosters, right? Like you are also interested in that. So NMN, rapamycin, interesting research kind of going on in those areas. So if we do this, and if we kind of take the animals through the cycle, I think that we probably resolve 80% of all the issues that are there.
I agree.
We kind of come on time.
Yes.
And then the rest may be more specific and maybe local. But why do we actually use this for that approach when we can actually help the whole body and support the body, and then it heals, right? And get out of the way, actually, that's the other thing.
That's it. Well, that's the hardest part, isn't it?
Yeah. Oh my goodness.
Oh, just stopping and saying, okay, we'll do this and this and this, and let's see the response. Yeah. And instead we tend to want to pile more and more and more. But that's the hardest thing for all of us to do, I think, as doctors, because we want to intercede more. And unfortunately, for the coaches, for the holistic pet health coaches, they've come up in an environment where people are like, do this supplement kit and do this supplement kit, instead of let's take care of the very foundation of the house before we start putting the window dressings on.
It's almost like I think that we need to learn the operating system of the body, an operating system of health and recovery, and then we can actually plug in almost any disease. And if we kind of like understand the operating system, what it needs, then the body really does recover. But getting out of the way is hard because and also the fear that we may forget something or we may miss something or we will fail, because in vet school, what happened when we didn't know? We failed exams, right? So they taught us to be kind of like worried a little bit.
Well, there was a lot of fear-induced learning there for sure. But the thing that cracks me up is there was a study that came out in 1990, and this is on the human side. And so they looked at the diagnoses that people received from the doctor in the hospital, and ultimately these people died, and they had postmortems. And
I don't want to even know.
So here's the upshot, is that 50% of the diagnoses were correct. So this is the thing, is that we take the science, we take the knowledge, we take the learning. But as you said, ultimately, you have to make your best understanding and your best plan and get out of the way and see what happens. Because if we have a 50-50 chance of putting the right title on it,
And the name, it's just a name, right? Like
Right.
it's not, someone says, oh, I have inflammatory bowel disease. It's a name for the condition, but it's
Yes.
not necessarily the cause and the reason.
Exactly.
There can be 100 different reasons why this is happening.
Right, because the first one is inflammatory bowel syndrome,
Yeah.
which means a constellation of symptoms and not a
Not,
specific.
not the core origin of
Yes.
that. Yeah, I find it really interesting how we are so keen to label things. Even when when you're in nature looking at a tree, you look at a bird or a butterfly, you want to know
Yes.
what it is.
Yes.
But when we actually really stop and start looking, not what its name, but what it really represents,
Yes.
then we may be actually much further along.
Yes.
Okay.
And that's it. Just allowing the butterfly to be the butterfly.
Mhm.
And yes, here's this constellation of symptoms, but underlying this, we know that X, Y, and Z are probably happening. So if we approach the body to support X, Y, and Z, then maybe the constellation of symptoms goes
I
away.
really like that because, I think that observation actually gets us really further. And I think it's the right way to go. Like, and not necessarily, like, I think that when we get out of the realm of preconceived ideas, the status quo or what we think it should be or it is, that's when we start discovering some things
Yes.
that are really mind-blowing. Like my late dog Sky, he taught me that diarrhea is often related to lumbar sacral injuries that can be caused by ball retrieving that I did.
Yeah.
And, he had diarrhea and I couldn't stop it until I started treating the back, which was
Wow.
like, it was like mind-blowing.
Yeah.
And so, yeah, people, or paw licking, many
Yes.
people don't think, and this is kind of simpler, that when there's a neck injury, collar
Yes.
injury, dogs feel something,
hurt.
it hurts.
Yeah.
There's neuropathy or
Yeah.
pin and needle sensation, and dogs will start licking paws. And they're treated for allergies and giving prednisone.
Right.
Imagine
So
that.
large intestine 4,
And you're a Chinese medicine
large
practitioner.
intestine
I'm not,
9,
but
master points of the front leg.
amazing.
Yes. So they're self-treating.
And there are many, many roads to Rome, but we also have to be careful about one thing. And I know that you're like that, and I do my best to be like that, to actually be humble, not to think that we actually know, well, we don't know everything for sure,
No.
but also not to think that we know more than others, because I think that that's actually, when you come from the point of lecturing in quotes or righteousness, then it actually usually doesn't come across, and people really need to understand that, I'm going to say it, we're learning too, actually.
Yes.
Yeah,
That's why
yeah,
it's called
yeah.
practice,
Yeah.
sadly.
Sadly. Practice with the license.
Yes. I'd agree with you, because I think what happens when we come across as knowing it all, we're coming from a place of the ego instead of from the heart. And if medicine is intention, and that's been stated through many different types of medicine, if we're operating from here and not here, we won't receive the information that we can then utilize to help our intention to heal that animal.
And the other thing is that we really have to be kind of very mindful of emotional state of our clients, and also understand where they're coming from. And I know that, I'm not sure what your experience is, but I've had a lot of clients telling me that when they go to a veterinary office, that they get lectured. And I don't think
Yes.
that it's intentional, or you shouldn't be doing this and so on. Like, first, our dogs, based on the law, are ours, and nobody else should be making decisions than us, and we can make whatever decision we feel is right. So getting lectured is actually not, like, I think that we need to really be mindful as veterinarians of that.
I agree. And I think one of the other big problems right now is that because the education system has become so didactic and
This for that.
this for that, and all of the answers are multiple choice, they're not in a paragraph form. So there is not so much the art of medicine, I think, is being lost. And part of that art is the listening skill and the ability to hear, but also feel what your client and what the animal in front of you are telling you.
And it comes with experience as well.
Yes.
But, conventional medicine, and we respect it because it can be very helpful in
Yes.
some situations and is life-saving. But, people have an impression that a lot of the conventional medicine and research in double-blinded study-based and peer reviews, and most of the stuff in veterinary medicine is not. And even in human medicine, you were just giving me the numbers. Right?
Yeah, so in a Cochrane review study, which is sort of the strongest piece of evidence, they did a review on the evidence for evidence-based medicine. And it turns out that about 11% on the human side of evidence-based medicine is truly evidence-based.
So,
So what does that
actually
mean?
much different from integrative medicine and
No.
alternative therapies
No,
and all
and
that stuff.
empirical
Maybe
and-
more, actually. But the funny part is that I think that most holistic or alternative integrative practitioners are actually open to conventional medicine and understand that there is a place for it.
Yes.
We kind of think that it should not be the first line of defense to
Yes.
put animals on steroids and
Yes.
do drastic surgeries and all that. But weird part is that the conventional establishment is not as open often to the holistic or integrative methods.
Well, so I started my career out as a very conventional veterinarian, and I woke up on a New Year's Day in 2005 with a screaming hangover, realizing I was a shill for the drug companies, and that what was coming out of my mouth was what I had been taught to say. And that's when I literally drove to my office and tore down anything that had any drug company's name on it and felt better. And then it's like, oh, what do I do now? And so that's where I know it's wrong, but what do I do? And I think that's what stops a lot of our colleagues because they are so overworked. They're overwhelmed.
And they have mortgages and loans and this and that. And,
Yes.
I know some practitioners who say, it would be so nice to practice integrative medicine, but I can't make any money from it when I stop selling food and drugs and all that. So it takes a little bit of guts, but I also understand. And again, if any of our colleagues, conventionally minded colleagues are listening, I trust that you understand that this is not to damage the reputation of veterinary medicine. It is just to kind of try to stay open-minded and know and understand that we can actually integrate everything and learn from each other.
Yes, yes, absolutely.
And,
because that's it. There is no one way. I know CCVM, I know functional medicine, homeopathy, chiropractic, all these other modalities. And it's the modalities that work for us.
Yeah, and our understanding of it. And I actually really I often learn from my colleagues. I learn from me so much, and I learn from other people about how to approach things. And, getting together like this is actually really precious because we are kind of dispersed in the world. Speaking of the world, I know that you're living in Slovenia and Montenegro.
Yes.
I live in Canada and partially in the US and Czech Republic. That's how life happened. My partner is a Canadian, so I just have to come to Canada, and then Vancouver, winter and rain. Oh my goodness.
No.
It's like if I don't get light, I think I may be really miserable. And also PAX. So we spent some time in the US. But what is your heart place, actually?
I love Montenegro. We all love Montenegro. Mary Jo, Hiyo.
Hiyo likes Montenegro.
Yeah.
She's the Montenegro girl.
She is. She gets to strut down the Shedalista.
She's a top bitch in Montenegro. Pax is kind of like, he's kind of like, I don't know, he's the Bradley Cooper of the parks of Prague. Maybe.
That's it. But this is it. So Mary Jo and I have been nomads since 2018, and now what we call ourselves is slow-mads. So we're good for about 3 months in one place, and then we get the itch to move. We've spent a lot of time in Mexico. We'll go back there this winter, but I think we will be mostly in the EU for the coming time.
And what I love on this is that I didn't even imagine that this would be possible. My dad was a vet, and he would have to be sitting by the phone. Actually, he would have to go to the practice and sit by the practice phone to actually wait for emergency calls. And then there were pagers. Here in Whistler, I worked here for 5 years, and we had pagers, so I could go skiing. But then I had to go down, and I hated the pager. And then we got cell phones, and now we can pretty much help dog lovers from anywhere in the world.
It's true.
Especially with the satellite internet, if you want to be in the middle of the mountains somewhere, we can still do that. So it's kind of amazing.
It is. It is an incredible freedom.
Yeah.
But yes, the pager was freeing, and then it was the devil, and you wanted to just throw it in
and drown it, stomp on it, put it in the oven, microwave it.
I had a friend, actually, she was on a horse call, and it was the 6th or something for that night.
Oh, yeah.
And she got back in her truck, and the pager went off again, and she got out of her truck and threw it on the ground and ran over it.
And it's not that we don't care, but I had situations here in Whistler where I would actually work 12 hours, and then I would come home, and I would have dinner, and there would be first emergency, then 11 o'clock second, 3 o'clock
Yeah.
third, and then in the morning I would have to get up. And this would happen for 3 days in a row. And I was feeling like
You
it's
can't
super,
function.
it's not our fault that we get upset. So it's not about caring. And, this is the other thing that when you actually see a veterinarian who may be who may have a short fuse or something, always ask, like, is there something, is there stress and so on. And I think it's so important for us to be kind to each other all the time.
I mean, I really pity our colleagues right now because so much of veterinary medicine is corporatized. They're on 12 to 15-minute appointment schedules. Come on, buddy.
Come.
Oh, she says,
I just have to pick him up. Oh, my goodness. You wanted to join. Oh, my goodness.
Because you're so dapper. But I think that's horrible because, first of all, in 12 to 15 minutes, if you've got a patient in front of you that's really sick and they're chronically ill, there is no way you can give that pet parent enough information to know what to expect, what they can do, what their options are. Mm-hmm. And I think that's part of it is that the veterinarians are incredibly frustrated, but they don't see a way out.
Yeah, the corporate nature of veterinary medicine, it's really difficult and it makes things much worse, whether it's, transitioning to natural diets or using fewer drugs and more integrative therapies. It's become more difficult. So if you have a private veterinarian who is not corporate owned, try to do anything that you can to actually help them.
Yes.
And obviously they are probably amazing, but we have to, I don't really know what the challenge is. And sometimes I feel guilty, even though we are slightly more mature.
Yes.
So we've done our practice and now we're trying to pass on the knowledge. And I miss practice actually to a certain point. I do.
Yes, I miss getting on the floor with the dogs. Yeah, really, that's what I miss. Yeah. But I have to say, I mean, what I'm doing now, training people, and thankfully we have veterinarians now coming into the coaching program, training them to understand functional medicine, TCBM, and to use whole food as the first step in health has truly been the honor of my career.
Tell me about the coaching program. So I would like to do a little review.
Yeah. So
see what's new.
See what to do. The thing is that it's a 16-week program. It's very intensive. It is accredited for 40 CE hours for veterinarians and veterinary technicians.
40.
So that's 2 years of CE credits
amazing.
For vets in U.S. and Canada. The vast majority of people that have come through the course are what I like to call the pet paraprofessionals, the groomers, the dog walkers, the pet sitters, the trainers. The people that see your pets on a weekly or monthly basis.
Dog butlers included.
Yes, of course. Yes, Hiyo's waiting for hers. She needs a hair appointment. But that's the thing, is these are the folks that see your pets on a regular basis, and they see the transition from this healthy 2-year-old dog to this 6-year-old dog that looks old.
And 6-year-old dogs should not be old. Like
old.
Pax just turned 6, and thanks to all the things that we've learned from him, he's been doing amazing, and he's still improving 1.5 years after we started the hormone replacement therapy.
Yeah.
So it's like, I think that
was a heck of a lesson too, right?
Oh my goodness.
That you must be patient and wait for the change to come.
And the fact that you kind of get a puppy and you think, I kind of know enough to keep them healthy. I know everything about nutrition and spinal alignment and, and supplements and all that stuff. I know enough to kind of keep them healthy. And then something else happens and you go, oh my goodness, I can solve it. I was actually kind of lucky because I asked one of my colleagues from the past who I used to work with. He is a board certified rehabilitation and sports medicine specialist. And he couldn't see me for 3 months. And I thought, okay, what am I going to do? Like I really, I need to see someone who may know more than I do. And he could not see me for some reason. So I actually started looking somewhere else, and I stumbled across the studies, and the rest is history.
Yes.
So since then, I actually sent him the information and said, hey, have you ever thought of hormone replacement therapy for all the injured and limping dogs? Because lack of hormones actually can cause cruciate ligament tears and muscle injuries and back injuries. I've seen so much, actually.
One of the first times we were chatting, you were talking about this story with Pax, and I said, yes, you just treated spay-neuter syndrome.
Yeah,
and again,
you coined it. Yeah,
yes.
And I did. I'm using that name. It's Dr. Ruth's term, or she coined the. You did.
Yes.
You did. You came up with it. I think it's great. Actually, it's a great name.
But the point of it is that it's a syndrome, which means that
It's
there's
complex.
all of these symptoms, and so at the end of the day, can we say that 85% of the dogs that have chronic illness might get better with hormone replacement? And maybe that's an overestimate.
I think it's close. I think that there will be much less chronic disease.
Yes.
And much less challenges. And the other part is that spayed and neuter dogs, strangely enough, because of the inflammation in the brain and the amygdala and emotional centers of the brain, are more dog reactive and emotional.
Yes.
And this is something that I didn't think was actually true or correct until I started observing it and watching.
Yes, and they are.
They are.
And so, and back to men and
women.
Going
upside down.
So menopausal women, when our estrogen goes boom, our brain function plummets as well, because all of a sudden, all of that balance that was there is gone.
Yeah, and it's not anyone's fault. If you think about it, between 40 and 55, most divorces happen. Which is like, I often think, like, is it possible that the hormonal changes actually can attribute to that? And obviously, guys, we go through andropause a little later.
Yes.
They become grouchy and kind of miserable and don't like younger guys and all that stuff. So I hope I will never be like that.
Yes.
But it is true, right?
Yeah, I think so. Yeah. And that's it. I mean, 45 was sort of the average survival time for humans up until, 150, maybe 200 years ago? And so we're physiologically well past what our bodies were meant to carry us for.
Basically, all of us are 40.
So everything else is, whew. Yeah.
Yeah. Life is interesting.
Yeah.
So you were saying that your heart place is Montenegro. For me, it's Prague, definitely.
Yeah.
And one of the reasons is that dogs just are accepted. They are loved. They can go to restaurants and cafes and beaches and lakes. Nobody would ever tell you to put your dog on the leash if your dog is well behaved.
Yeah.
And my sense is that when you don't really put too many rules out, that a well-functioning society actually organizes itself, and it doesn't need the science and the bureaucrats to tell us what to do.
That's right.
And it just thrived there so much, because it makes me so happy when I go to a park and there's like kids and dogs and parents and grandparents, and everyone is together and they're having a glass of wine at a park. Nobody tells them they shouldn't.
Yes.
And
I agree. Yeah. I mean, I think the regulations and the rules make society in general much less responsible for itself, because now it's the government's responsibility to take care of you. If they're going to put the rules, then and that's not happening.
And the other thing is that when it comes to bureaucracy, that's one thing. Bureaucrats like power, petty power. But then there's politicians, and the politicians can only win when they divide.
Yes.
And so then we suddenly turn into the dog people and non-dog people, and the cat people and the dog people.
Yes.
And, like, why don't we just let each other be?
Yeah, I don't know. But the part of what I love about Montenegro is the cats, because they are everywhere. They are well respected. And in Kotor, the cats actually saved the people from the earthquake. I think that was back in like 87. You never heard this story?
No.
All of the cats in Kotor all of a sudden were just acting bananas. They were yowling and screaming and demanding to go outside. And the people saw that the cats were like getting the heck out of Dodge, and they just followed them. Wow. And then boom, this massive earthquake hit and just leveled so much of the city. So so cats are now like
totally revert.
Yeah. I mean, they're revered. Yes.
Yeah, my English.
Your English is marvelous. But now, marvelous, darling. You're looking so marvelous. But they're revered to the point where there are cat parks, there's cat houses all over Kotor. And
a cat lover, so you must be totally thrilled now.
Yes.
I must say, and I'm not going to deny it, I am a dog person, but I very much respect cats for their qualities, and I think they're the most evolved species on the level of survival. Dogs are probably second on the level of survival, but I think dogs are just like, let's be honest.
Well, they evolved with us.
They evolved with us, and I just love when my dog kind of shows that he worries about me. Who else does, right? Like, whatever.
When we started traveling, we had a cat named Pepe, and Pepe was a dog cat. So Pep dealt with learning how to be in a pack.
And bark.
Yeah. And he would hike with us. So he figured out how to deal with all of that. He wasn't thrilled about it to start with, but once we sort of said, well, this is kind of the deal. He's like, okay, fine.
Nice.
But yeah, but he was definitely a unique kitty.
I think Hiyo's getting a little impatient. So I
Yes,
think
she's
that,
dancing.
I so appreciate you for actually making the time to spend time with Pax and I and my partner. Where can people reach you?
Up here at drruthroberts.com. It's super easy.
And it's drpetertobias.com. And subscribe to Dr. Ruth newsletter because she sends a lot of really useful information. And if you have the extra typing energy, you can subscribe to Maya as well. And so that's drpetertobias.com. And yeah, really nice to see you here. We'll see you later. And thanks so much.
Well, thank you.
It's so much fun.
It has been fun. Yes.
Yeah. Yeah. We have to do that more often, I think.
I think so.
Yeah, we have a good rant going on.
We're rapping. Yeah, no, and that's it. I think it will be, it will be amazing. And it'll be so much easier going forward too, because after we're back to Montenegro or Slovenia in March, we will stay on the.
Yeah, you'll stay there, and I'll be 11 time zones away.
Yes.
But I find it really cool that sometimes, like with some people you have nothing to talk about. With you, I could talk for 12 hours.
I know, that's fun, and that's beautiful too. Mary Jo was having such a good time talking with Dean. And,
they're chatting.
Yeah. I mean, so this is awesome. She gets fed up with my vet friends sometimes. It's like, God.
Bye, guys.
Ciao.